plane, I started bleeding. Just not much, but some blood. And my urine was pink for a while. And then it was then on that Friday, I was having so much pain in my penis that I knew I had some kind of blockage. And I had to lift my leg like a dog to go. So I knew that I probably had a stone. So I went to a urologist on the next Monday, and I had him do a ultrasound sonogram. There was a stone as long as my thumb, as round as a ping pong ball. He'd never seen a stone that big in his life. So he said, probably take 45 minutes to blast it to pieces, with no surgery, They call it surgery. What they do is stick a pipe up the urethra.
God, that hurts.
Yes, I know. I was out. And they put 4 things up in these pipes, and they're that big. And when I went into the operating room, I said, I'm glad I'm not going to be awake for this. Pipes, metal pipe this big around. And they have one that's the visual, the video, so they can see what's going on in there. They have the laser, which blasts the stone apart. Then they have a water jet, which flushes it out, and then a suction. So all those, 4 of those go up this tube on my penis. And surgery was set for an hour. It took them 2 hours to blast it apart. 2 hours. He said that stone had to have been growing at least 50 years. That made a lot of sense to me because any time I urinated, it would take me 2 to 3 minutes to the point where I could start peeing, and then my stream was like a little baby's. He said that when he went in there, he found that the urethra never developed. So I was like an infant there. My mother, when I was about 2 years, 2.5, when she started taking me into the women's restrooms, would get very frustrated, hit me on the shoulder or back because it would take me so long to go. And so what I learned to do was I learned to get the pressure off and then not empty my bladder completely. And he says that's what causes stones. So my stone had been growing probably for 58 years. 58 years.
We would the stone actually
in the bladder.
In the bladder.
Sitting right in the bladder, right there where the track goes down. He said it was so big he couldn't imagine that it hadn't caused me problems before.
You never had pain down there?
Pardon?
You never had pain?
Nope. If it started when I was 2 years old, my bladder wall was this thick. It's only supposed to be this thick.
Because of the stone.
The stone had irritated it. And the bladder's supposed to be a smooth wall.
Yes.
And it would look like coral. The same way the stone looked like coral. So now I pee like a horse. No waiting. I mean, that's so weird because I'm used to going to the toilet, stand there for 2-3 minutes, waiting for it to start. Then the stream was very tiny, and that's the way it's been on my whole life. And now for 2 months, I'm peeing like a horse. It's great. I only 15, 20 seconds, and I'm finished. It's great.
They put you out? You had anesthesia?
Yeah, and you can see the poisons coming out of my skin from it.
But what did you have, IV sedation or general?
IV, general IV.
So what does that mean? They put you totally to sleep?
Yeah.
The gas?
No, they did it with, injection into my IV. But I didn't let them give me any antibiotics. I told them that I was allergic to all injected antibiotics, and they'd have to give me oral. So they gave me all these oral antibiotics, and they went in the garbage.
What state were you in?
Pardon?
What state were you in?
Here.
Oh, here.
Yeah, well, I was in Los Angeles.
How much did it cost?
St. John's, 10,000.
Oh, my God.
And you didn't have insurance?
No.
But at least that would get it out.
Oh, it was incredible, yeah.
What kind of stone?
I wasn't emptying my bladder all those years.
So the minerals would
So the minerals would collect and pour it into stones. He said the center was entirely black. So I said, save that soup because I want to have it analyzed. So I did, and it was most of the concentration of heavy poison was mercury from all those injections. That center was almost an entirely mercury ball.
So the diet didn't take care of that. The diet couldn't.
There's no way. That's stone. That's hard. That was like metal. He said it was like blasting metal apart.
Wow.
He said the nurse told me he was just sweating because he couldn't get it to break up.
Jackhammer.
Yeah, it was like a jackhammer.
So that stone was 1.5 inches to 2 inches diameter.
No, it was about the size of a ping pong ball, so it's about 1.25 inches round and as long as my thumb. So about probably 4.5 centimeters, 5 centimeters, somewhere around there. I've got the pictures. I should have brought them, but I didn't. It was huge, huge. And all of the other urologists and the nurses said they'd never seen a stone that big in their entire lives.
That's one way to get mercury out of your system, isn't it?
Yeah. Well, it obviously held on to it.
But it wasn't doing me any harm, let's be honest. It wasn't doing me any harm.
No, it did. All that time it hadn't done me any harm.
After he blasted it out, did they have suction tubes before that?
Yeah, like I said, they have 4 tubes up there. One's a jet for water, and the other's a suction.
So if he couldn't get it out, he'd have to go
Surgically go in and remove it.
So you're lucky he sweated it out.
Yeah.
You've got to say pain has got right now.
What was your recovery time, and what did you eat after?
Well, 2 days later, I was juicing coconut at the co-op, out of the new machine, showing them how to do it, ripping coconuts apart. So in 2 days, even though I had a catheter, Well, actually, I had the catheter put out right before I went there to do the juicing. So it took them 2 days before they took out the catheter, and probably because I had them because my urethra had never developed. I asked him to cut a wedge into it and into the prostate gland, so it wouldn't happen again. So I had a lot of burning and pain for probably 3 weeks.
What did you eat after the surgery?
Well, I was downing, probably 25, 28 eggs a day to get rid of the, medication poisons.
Yeah.
Pardon?
Just the eggs straight?
Yeah, I was just taking the eggs mainly straight, and ate lots of cheese. I ate 5 pounds of cheese in 7 days, pulling it out.
Did you let him do x-rays on you?
No. He was allowed to do a sonogram. Yeah, it was.
So you've never had a spinal x-ray done, but it's for a chiropractic because they would have seen that stone.
Yeah. Well, if they look down that low to the bladder.
Of course, it's a bit below the spine.
Yeah, right. Because I had some, after they did the cauterizing my spine and I was in pain all the time, I did go through a series of x-rays when they did some back surgery on me.
Right.
When I was 22, 21, 22. So, did x-rays then, but didn't show the bladder low. They showed from just about 2 inches below the waist, for about 8 inches up. Because I was very particular even then about how much irradiation I was going to get even from x-rays. And that was probably the last time I got x-rays, except for that when I was in an automobile accident in Thailand where they, I broke my collarbone, my clavicle, and 2 ribs. Yes?
You carry around a lot of stones that are all
Well, James Stewart had 10 in his that he had blasted about by the same urologist. about 12 months ago, 11 months ago.
His bladder?
Pardon? His bladder. In his bladder. Yeah.
You do the same for liver or gallbladder?
No, because you have to go in surgically. You can't go up through the urethra if it's in the kidney or in the gallbladder or liver.
You can't pass those stones in the gallbladder?
Yeah, you can pass, not in the bladder, the urinary bladder.
Gallbladder.
Yeah.
It wasn't called liposuction, was it?
I don't remember. I'm sorry, I can't hear you with the airplane.
What did you do generally not forming stones for some diet?
Well, the diet, yeah. His, the urologist's theory is that if you remain alkaline, you won't form stones, but that's on a regular diet. Because everybody eating cooked foods has already cauterized their minerals. So they're already free radicals. So they're always going to be locking and magnetically attracting each other. Then if they are heavy toxic metals like that, your body's going to take calcium and other minerals and try to lock it so it doesn't create damage. So mine had formed a good calcium level all around it. Why all of a sudden it started hurting me, don't know. Because it was huge. Huge. Why it all of a sudden started causing me problems, I don't know. Probably because I'm flying so much. As soon as I got in an airplane, the blood would start. And that started about a year ago. Get on a plane, I'd see a little blood, a little pink. Never think anything of it because I'm used to having constipation. And, for 58 years I had constipation until I got that tapeworm. And every time I had a bowel movement, I bled. A lot of blood compared to this. And just a drop or two. Or just some pink urine. So it wasn't anything that bothered me. So I just figured I was maybe passing some heavy metals or some toxicity through the bladder. And that was that. I had no idea I had a stone until I had to actually pee like this to get the stone to move aside. Because it was blocking the tract of why all of a sudden it started blocking, I don't know. Because it was huge, you could have blocked it at any time. It was amazing. Still perplexed about why, all of a sudden it started giving me trouble on that week.
You just didn't move the right
Painful.
way.
That's it.
That was actually painful in your bladder as well as the fact that
No,
you urinate.
no pain in the bladder. It was all in my penis.
Because you wanted to urinate and couldn't.
Well, it actually burned near the head, and I asked the urologist, I said, wait a minute, if I've got a stone up here, why am I not feeling pain up there? Why am I having in my penis? He says, I don't know, that's what happens though. All men have, pain in their penises.
Maybe there are no pain signals in the bladder.
Could be the
nerve.
bladder's so numb, so
Yeah.
thick and irritated for so long, probably not many live cells there. Callous. And that wall was very thick.
Why did James Stewart get the stone?
Well, he'd been a vegetarian for 30 years, eating lots of soy.
Okay, that's good to know.
But a lot of people, anybody who eats cooked food has a tendency to, collect minerals like that. Just why some people develop them depends upon the individual. My case was I didn't empty my bladder. And it started when I was about 2 years old, 2.5.
You want to borrow my hat?
No, just when it glares through the cloud, it's really bright sometimes. So that's my news on that. I did, like I said, I refused all antibiotics. What I had to do to get him not to give me antibiotics was tell him I was allergic to them. And he said, well, what will happen? I said, well, I could go into anaphylaxis and have a cardiac arrest. And boy, he didn't want to hear that. So, you know, immediately he said, let me go get some antibiotics. So he gave me antibiotics to take before the surgery. And I said, I took them. That doesn't mean I swallowed them. I took them from him. So I took them. So I didn't lie. I took them. And, you know, and then they gave me a bunch to take afterwards. You know, 2 prescriptions, one for pain and one for antibiotics. And I didn't fill either. And I just dealt with the pain because, you know, just eating the pain formula is what I did, and eating the cheese and the pain formula. And the cheese was to help draw the poisons out into the intestines so they didn't float in the system. And, you know, I continued eating meat and everything else, drinking lots of milk for the sulfur, help draw the toxins out of the system. Eggs and the milk are the highest in sulfur. Sulfur is a good cleaning agent as long as it's ionically bound with other nutrients. When you have isolated sulfur like in MSM, highly toxic. And some people, and 3 women that I know of, they spontaneously combust because that sulfur turned in with their particular body fluids turned into nitroglycerin. And as soon as it hit their skin, they could spontaneously combust.
What do you mean by that? Spontaneously combust?
They went up in flames.
Burn up right now.
Really went up in flames. Really flames, yes. Actual, not just burns, chemical burn. They actually went up in flames. 60 Minutes did a thing on them at about 70, 69 or 70. And I was working for MGM at the time because I was too sick to do anything else. And I got a hold of because I was studying nutrition at that time, to help myself get well, and I was very curious if these women had sulfur. So my publicity agent was the head of MGM publicity department, so I got him to get their names and addresses, and I wrote them. And the woman who had 75% of her body had burned, her skin area. She had taken the sulfa drug for bladder and kidney infections for 32 years. The one who burned up about 60% of her body had taken the sulfa drugs for 22 years. The woman who had burned a quarter of her body had taken the sulfa drug for 12 years.
What MSM?
No, but MSM is sulfur.
I know.
It's isolated sulfur, so it isn't bound with any other nutrient. So you take MSM and you have no idea what it's going to do. Sulfur is a drying agent. That's why they used it for kidney and bladder problems, to help remove swelling and fluids. Also during the 60s and late 50s and early 70s, they were using sulfur to test it on everybody as a possible antibiotic. So a lot of people got sulfur drugs.
What does sulfur detoxify you of when it's with excess milk?
How does it detoxify you?
I mean, what does it bind to, or how does it take?
Well, you have good natural sulfur that's bound with other nutrients, and it attracts the toxic sulfur.
Okay, got it.
Like attracts like in that case. Okay, we're going to start the Q&A. You got a question?
Mm-hmm.
Okay, we'll come back if you do.
She's a newbie.
But she read the book.
Friday night. I have lots of questions, but I'll probably get more as I listen.
Okay.
I'd like to get a discussion on emotional detoxification. So what I'm noticing lately is, and I don't know, but it feels like old stuff coming up. Asthma, but not asthma. I'm not, I'm not getting the symptoms, but I'm feeling tightness. I remember the feeling of asthma. Is that possible? Do we go through emotional detox on your diet?
Well, everybody goes on any kind of a diet. Just remember that this diet does not cause detoxification. It allows detoxification. When you're eating cooked foods, your body's always dealing with the toxins that you're putting into your body, whether it's the free radicals, the minerals that have been fractionated, whether it's the lipid peroxides or the heterocyclic amines, all those byproducts that are toxic, and I named 32 of them in the recipe book that form from eating cooked foods. So if your body's dealing with all those toxins every time you eat, it can't deal with a lot of the old stuff. And it's dealing with digestion, and the pancreas has to synthesize hormones that'll call out, like thugs, and leach from every cell a little bit of nutrients to deliver to the intestines to be able to digest the cooked foods that you've eaten. And that just spins your bank account till you're up there in your 50s and you have no more. That's it. It's over. And that's why people start having the most serious problems when they hit their 50s. Most people. When you're detoxifying, it's easy on this diet. Like I say, it doesn't cause detoxification unless you eat a lot of fruit, a lot of oils, or a lot of coconut cream in combination with fruit. And that'll force detoxification. I suggest that everybody detoxify with one fruit meal a day with coconut cream in the afternoon. But that won't incite an extreme usually. In some people it may. But to your specific questions about the emotional factor of detoxification, according to Elnora Van Winkle, a neurological scientist, and she's the one that called about 260 of my cancer patients and saw that they were living over 7 years, 5 to 7 years past when they went on the diet. And she confirmed it. You look on the recipe book, you see that last testimonial that she says that the statistics on this diet are correct for cancer. She was responsible for cataloging every chemical in the neurological system and brain. 47 years she did that at Milhauser Laboratories at New York University. So she said that just like any other toxin has byproducts in the body and has a tendency to store in the body, so do these neurological hormones that form during emotional crisis. So let's say you had asthma. When you were having problem breathing, you had created a certain panic in your body that created neurological hormones, and there were byproducts that need to be removed from the body, or waste products. And she said that whenever she found these in high amounts in the blood, that person was going through some emotional turmoil that did not relate to something that happened in their life at the moment. It was not happening at this present time. It was happening, it's like she had a girlfriend who was, or a friend who was a girl, that was just 1 week just flipped out over her husband, just was on him like a hip pocket. And she tested her blood, took her blood every day and tested it, found this hormone level high. When she came down off of that experience, she tested the blood, and that chemical was non-existent, or just trace amounts in the blood. So she said that when you go through these detoxifications, these neurological hormones that are developed during any kind of trauma, then you'll re-experience emotional trauma or the trauma you were experiencing during that trauma. Yours happened to be asthma, probably the fear of not being able to breathe. So you're having that sensation, although the physiological is not occurring.
No.
And if you would like to read her paper, she has, it's called The Biology of Emotions, and you can find a technical version, which is extremely technical, has every chemical it identifies, and then there's the layman's explanation. Now, her idea of the cure for it was to go into primal therapy. That does not mean the diet, although she advocated the primal diet. But the primal therapy that she was thinking about was you go and scream and kick and fight and beat and do whatever it is in some little, house, a little soundproof cottage, that you built for yourself. And I argued with her about that. I knew her personally. She was on the diet. She came to me as a patient in New York City. And I said, I disagree with that because you're continuing the turmoil, the trauma, by going through all that anger. I said it would be better to sing, to dance, to do something you enjoy while your body's detoxifying this. So you reprogram the body.
That's really strange. That's what I've been doing.
Yeah.
I've been singing.
Good.
Meditating, chanting, just walking, just happy. In a car, I can do that. I commute every day.
Right.
It's like I'm nothing, not even on the cell phone.
No karaoke, huh?
No, that's
That's how I resolve, that kind of thing. Otherwise, when you have that sensation and you feel anger or fright, you're just getting back into it. You're lingering it. You're procrastinating with it. You're continuing it. So anytime that comes up, you're going to go into the same reaction instead of something more creative and happy. So that's how I resolve it. That's how I suggest that people resolve it. You're welcome. Do you have a question?
Yes. How do you...
Elaine.
How do you deal with or prevent or keep neutral with receding gums and teeth, the gums part of the teeth in general?
Well, it's going to be almost impossible to do. The brain has the most toxins stored in it. The brain and nervous system use heavy metals, metallic minerals, to relay light and electricity. So when you cook a food and you set free any trace heavy metals, iron, mercury, cadmium, lead, anything like that, the concentration of it will go to the brain and nervous system. Most of it goes in the brain. That's why we have the largest brains on Earth, and yet we're the stupidest as far as taking care of the planet.
What if we're on this diet?
Doesn't make any difference. When you detoxify, most of that, 90% of it, doesn't go out through the mucous membranes or the eyes. If they did, you damage your eyes, and your eyes would get progressively worse. If it dumped out the tear ducts. But it dumps out the gums, tongue, salivary gland. So when it dumps out the gums, it irritates the gums. It causes them to deteriorate and bleed. And it's heavy. So what I suggest that people do is, rather than having the scraping, and that's what causes dental decay. It isn't germs, it isn't bacteria. It's these heavy metals, especially from vaccines, the combination of formaldehyde, mercury, and aluminum, and the detergent. And it comes from the brain, goes down and around the teeth, and the body uses a lot of calcium to bind with these poisons, and that causes plaque. And when that plaque irritates the dentine because of the heavy metals damaging the dentine, then bacteria results to clean up the damaged dentine. The bacteria does not cause the decay. The toxic metals cause the decay. So what you can do to relieve that is you get a water pick, one of the stronger, not one of the little ones that is weak in jet. You need one of the bigger ones. You know, it has a tray like this, like water pick has. They've got the small cylinder ones, but it doesn't hold enough power to use this formula that I'm going to suggest for you. And what you do is take a tablespoon of coconut cream, tablespoon of lemon juice, tablespoon of raw apple cider vinegar. You mix it all together, and then you strain it through a cloth, like a t-shirt, a white t-shirt that's been rinsed and rinsed and rinsed. There's no soap in it. Then you put that in 3 ounces of Gerolsteiner water, and you stir it until it's mixed evenly. Then you take a cup of Gerolsteiner, and you pour that into your water pick. Pour that mixture in there and stir it with your finger a little bit. And then you brush your teeth, brush down as high up into the gums as you can. And then you take that water pick and you jettison it into your gums, deep into your gum pockets, between your teeth, everywhere. And that combination of the coconut cream, the vinegar, and the lemon juice will dissolve plaque. If you do it every day for 10 days, it usually gets the hardest plaque that there is, unless there's some concentrated heavy metals, just like in my bladder stone. You may have to do a little bit of scraping, but it's preferable that you don't get a scraping. And you do that then once every 10 days, 7 to 10 days, and that'll keep your gums clean, and then you'll have less gum recession.
What about getting, but I just went for a cleaning and they said, oh, gums are receding.
And they're always going to recede.
They always say that.
Yeah.
But if I had a cleaning, a thorough cleaning, I could feel it was very clean.
Yeah, but you need to do it every 7 to 10 days. That way you'll restrict the I stopped them. When I started doing that, my gum recession stopped.
Right.
Yeah.
So it won't grow back.
A little bit. Some of them has grown back, but not all of them.
On this diet,
And these didn't grow back.
Shouldn't it help on this diet, though?
Yeah,
all the
it
milk
should.
I drink.
Oh, definitely.
Milk and butter.
Yeah. But just remember, a lot of that calcium from that milk is going to go to bind with those heavy metals coming from your brain, dumping out your gums.
Can you use coconut oil because coconut
Doesn't do the same. Coconut cream has your water-soluble fats as well as your fat-soluble. And there are more water-soluble fats that dissolve plaque than the oil does. What the oil does is the minerals will absorb the oil and soften, but they won't break it up. The water-soluble fats in the coconut cream will help break it up and dissolve it, especially when reactive with lemon and vinegar.
It's pretty acidic. Won't that that's the benzene?
No, it's too diluted. Too diluted.
Can we buy any kind of water pick or whatever the brand is?
As long as the heavier duty, powerful one. Yes.
I had a client who received gums were receiving a lot of, and the pocket, they measured them and they said, we're going to have to operate with you, too deep. And so she's not on the diet, but she's on reasonable carbohydrates. And so I gave her the Tyromin clay, fine one, Cerasil, to clean her teeth with once a day. And she rolled little clay long things to put around in her mouth and leave it all night. And she went and got her pockets checked 6 months later, and they've all gone back. She doesn't touch them except one, the very back, which she said, I didn't put enough clay there.
Right.
And so they've all receded, and she said they're going to leave this other one pocket until another 6 months.
Yeah, because the nighttime is when your nervous system and brain detox.
So the clay took it all out.
Yeah, but the clay will help pull it right out, so it won't settle in the gums. It'll pull right down into it. But most people don't want to put clay in their mouth at night unless they're desperate.
I mean, why not?
Yeah. Well, a lot of people don't want to wake with that clay and it's all over their lips and mouth. I used to do it a lot, but people just don't want to do that. So. But it will work.
Yeah.
But
are you against cleaning the teeth with clay now? I had a feeling you might be. I want to ask. I mean, I won't ask it, but sit with the clay with the top. Maybe that. I want to wait.
We'll wait on that. Okay. Do you have a question?
I want to add her question actually. The root canal problem. I was going through one. After that, I didn't get any access. Just the pain went away, and it's very minor. Something I have to worry about.
I wouldn't. It's usually an abscess is better. When you have an abscess, that means the toxins that the bacteria or the fungus, or which is yeast is a fungus, or parasite that's breaking down that toxicity around a nerve on the tooth that's still on the tooth from the outside. When they have a root canal, you've got the nerve that comes down to the root of the tooth. Right. And they drill it out on the inside and all the nerve up to the tooth. And they've got a little space that's, maybe a fraction of a centimeter.
I didn't get any words on the I just went through the pain process.
But did you say it had been a root canal?
No,
they wanted to do a root canal. Was that it? Yeah.
Right.
Yeah.
So could it heal?
Pardon?
Could it have healed on its own, or?
Did you have a root canal done?
No.
Oh, okay. Yeah, it can always heal on its own. Yeah. I was supposed to they wanted to remove all of my teeth when I was 21 because after the chemo and radiation, I lost all the bone around my teeth, so my teeth just dangle. Yeah. And if I went like this, I bled a half a cup of blood. So I used these big straws to eat everything through, And I didn't realize, I said I'm going to die in 3 months. I'm going to suffer the pain of all the extractions of my teeth for the last 3 months that I'm going to be alive. So screw yourself. So I didn't have it done, and I started drinking lots of raw milk, and within 2 years, my bone all grew back.
On her question?
Yeah.
I did 4 months of eggs when I came out of this colon problem. And I had 2 teeth that had to have root canals. And when I went to dentist this time, they're not needed anymore. Is that part of it?
Yeah, it's part of the healing process.
I mean, it's like, I couldn't believe it. It's like, 2 dentists told me they want to do root canals up here. And it's gone.
And if you already have a root canal, and they tell you need to redo it, whatever.
Indeed, what they want to do with root canals, they want to remove your tooth now. That's what they want to do, because they say that nerve that attaches to the tooth and that little bit of space there causes mass infection.
Yeah.
Well, it doesn't have to cause mass infections if it's going down the gum and leaking out as it should. If it's not, if it's jammed up and you've got, like the bladder stone, you've got heavy metals up there blocking the area, then you're going to have to go into some kind of severe reaction like a toothache and hope for the little abscess and the bacteria will help break down that mineral deposit and dissolve, and then you'll pus and it'll be all over and your teeth will remain. I've done that. It's happened to me a lot. And I've only lost 1 tooth with that process. And I was supposed to lose all of them. Do you have a question? You, yes.
Yes. Having drank all this milk, I have like a big belly. You get like I don't digest the milk as well.
Well, that's not because your babies, they have big guts. You say they're not digesting it.
How do I get around that? What do I do?
You don't get around it. That's part of the process. To distribute the food, it has to go on here first to go to the rest of the body.
But I don't seem to lose that stomach.
You don't want to.
I'm on the same boat.
You should be that way for, at your age, you should have that stomach for 20 years.
You don't want to hear that.
If you're young, 4, 5, 6 years. If you're under 30, if you're under 40, 30 to 40, It could be 10 to 20 years. I mean 10 to 12 years. And the older you get, the longer you need to maintain it.
Why?
Because most of your poisons dump into the intestines, except from the brain that comes out the mouth. So your intestines need a lot of fat, and a lot of food there, and calcium to bind with those poisons so they don't damage the rest of your body.
So that means when they're predicting this pandemic, we're going to be safe.
Yes.
I mean, seriously.
The fatter you are, the better you will be.
Lack of digestion.
No. If you had a lack of digestion, you'd be in cramps, and you'd be nauseous and vomiting. You'd have terrible rashes if it were coming out of your skin. That's a sign of indigestion. Do you have a question? No? Okay. Do you have a question?
I had a severe allergic reaction. I don't know if it was in the chemicals or something outside for about 2 days. It was sneezing. I did the eggs. Is there any other recommendation when you get a severe, I don't know, influx of whether it's pollen or something or anything during that period of time? You just overdose on eggs or...
Well, another thing you can get to get things moving a little quicker is take hot baths. And you look under the lymphatic congestion in the book and look under lymphatic baths. Do that, but not that long. Do maybe 50 minutes. And what you might want to do is put some, ginger, juice some ginger, and put about an ounce of ginger in the water, along with about probably half a cup of coconut cream and a cup of milk and 2 tablespoons of sea salt. Well, you can leave out the vinegar. Yeah, 1 cup of milk, half a cup of coconut cream. And, well, the ginger in that mixture will help aspirate the body. You're going to breathe some of it, and it will cause more perspiration from the lung and sinus area. When you use vinegar, like I normally say, and without the coconut cream, that much coconut cream, it causes a detoxification uniformly all over the body. But when you use the ginger and you're breathing those vapor, that moisture, that mist, it will cause more detoxification and elimination in the respiratory system, in the pulmonary area. That and lots of cheese to absorb the cheese, yeah. Cheese to absorb. Yeah, I would separate it. Yeah, I would have the egg first, and like 20 minutes later, 30 minutes later, the cheese.
And that's for any exposure?
Any exposure. You're welcome.
You said 50 minutes, 50.
Pardon? 50, yes, 50. Do you have a question?
I'm going to have a reading. I wanted to ask a little bit about air quality.
Uh-huh.
And I think I told you that I was in the
Wait a minute. Okay, shoot. I still didn't catch it.
There was a plane that came over the beach. I think I told you about this. 5 planes that came over.
Oh, 5 planes?
Yeah, they dumped some, I guess it was fuel, probably.
Uh-huh.
My guess. And then after that, I got told that.
Yeah.
It's been like 15 years. And my friend,
Well, you're inhaling diesel fuel.
yeah.
That's full of heavy metals.
So my girlfriend was telling me that she saw it in the museum, it's kind of in the back of the paper, that there's a lot of that going on in San Diego because of the Navy and kept military and Myanmar.
Absolutely.
All dumping
Yeah.
their fuel because they have to have quotas. They get per year, but they haven't even left. They have to dump it off or something.
Yeah, and also so the plane won't blow up if it lands improperly.
So my question is, like, how long does that stuff linger in the air, and how long can you measure it? I mean, because the air is so vast. But how do you, what happens to those heavy metals, and how do they dissipate? And how long does it take?
Well, it takes a very long time.
And where do they go?
They will fall to the ground eventually, but if there's a lot of fog or moisture in the air, they suspend a long time. About 20 years ago, there was a whole herd of cows in near London, just outside of London. A factory was discharging its pollution from the smokestacks, and the fog was unusually heavy, and has suspended it over this herd of cows, and all the cows were dead in the morning because they just inhaled it all night. So moisture and fog, which is heavy moisture, mist, will hold and suspend the poisons a lot more.
How can they measure air quality? They don't give these air quality reports, and really only report quality. They don't report heavy metals, chemicals in the air.
That's right.
So there's really no way to know how much is in there, right?
They don't want you to know.
Yeah, so...
All you have to do is look at the sky, and if you see it kind of tarnished, if it gets orange, pink, then it's pretty heavy in chemicals.
My question is on that. So when you're exposed to people or heavy metals...
Well, there's a lot of Asians that have no trouble wearing masks. They're not proud.
Mm-hmm.
We should listen to them. And I did. I got a huge, in my trunk, I carry an Israeli gas mask. And if it gets heavy, I put it on.
Well, I guess my question is...
Absolutely.
Is when you have exposure, do you also tend to dump some of your own stuff? Do you just kind of start a whole cycle?
It can at the end.
I'm also having a detox from stuff in the house.
Yeah, what usually happens is your body will start detoxing or just handling the pollution that you're receiving. And then when it finishes doing that, it may start taking some of your old stuff along with it, and that will lead you into a heavier detoxification. It doesn't happen with a lot of people, it just happens with some.
What does she do?
Yeah, you just don't lie down. You can't lie down. If you lie down, you've got gravity pushing your lungs shut. And when your lungs are detoxifying, that means it's like having an 8-lane highway and only 2 lanes open. There's no strength there, so don't lie down. You sleep sitting up, where the gravity pushes your lungs open. And that's very important. That's when you detox the nerves going to the lungs. Everywhere.
For heavy air metals, basically eggs, cheese, milkshake, kind of that.
Yeah, any of those.
If you're digested, this is like I suggested with meat, cheese, kind of making more digested.
Well, you have to understand that when somebody's clicked off here, you have to understand that when no, it was his. This one. When you're detoxifying, your body's going to take a lot of calcium to neutralize, because calcium is highly alkaline. So is phosphorus, so is potassium. And those are the minerals mainly in concentration that your body will use to neutralize those acidic poisons. That heavy metals are all overly acidic and they burn the tissues. Mucous membrane, any kind of tissues, they can burn it. Even though it's not fire, it burns it, like you could take radioactive material and get a burn from it. And that's what happens internally in the body. So the body uses these other minerals that you get in cheese in concentrations and in milk and in eggs to bind with those. Of course, it's going to make things a little drier. But that's why you're supposed to have, a lot of cream and honey and egg. May have a milkshake to help the mucus form. It's different, entirely different. If you have the eggs and the milk, the cream and the honey together, you'll form more mucus. Eggs alone won't do it. Cheese alone won't form mucus. Milk alone won't form mucus usually. You want to form more mucus because the stuffy is the dryness. You want it to flow because that's how the poisons are relieved, through the mucus. Look at it this way. Let's say you were a sexual person and you wanted sex and you were dry. Would that work? Yeah, you need lubrication. You need something to help that flow out of this area as well as this area.
Good example.
Because you can't breathe. You breathe, it's going to be dry. That's like having sex, without moisture.
So just cheese and the milkshake, both
Yes.
together. Just one together.
Well, you don't necessarily have to have them together. You might not want to have them together. You have them separately from the milkshake.
And sex.
People get that example real clearly when you're talking about mucus. How important is mucus? That's how important mucus is. Yep. You want it to flow. Otherwise, it just stays up in your sinuses. All those poisons. And then your blood has to work at cleaning it out. And that causes headaches, more sinus congestion. Then it will dump out the lungs instead of out the, the mucus from the nose. So, milkshakes? No, I would probably say max 3 a day if you're really dry. Lubrication formula does not help mucus flow. Completely different. Pardon? That's to lubricate everything, not to get mucus to flow. And to give you lots of fuel energy and strength. It can lubricate the sinuses, but it doesn't help mucus. Yeah. Mucus is a liner, not a lubricator.
So lubricate from what in your body?
Fats lubricate.
Fat.
Yeah.
Great. Well, that helps clarify a lot.
Good. Do you have a question, Michael?
Yeah.
Oh, thank these two for being our hosts again and again and again.
So, does penicillin come from fungus?
Yeah.
And fungus is a form of bacteria?
No, it's not a bacteria. They do eat things. They decompose things.
So, I guess, it's not the same as bacteria.
No.
And so the bacteria is like a natural antiseptic. It's the right type of bacteria. Is that correct?
Well, there's so many. There are thousands of bacteria, and they do different things. But a bacteria is an organism that's like a creature. A fungus is a mycelium. It's like the blob. It's a liquid. Most of it looks like this. Some of it's yellow. When they treat it, it's almost all yellow. And if you pull up roots or ground, from a tree or grass that is dead and dry, and after it rains, you'll find a milky substance, and that's called mycelium, and that's what eats the roots, dead dried roots. it creates a mushroom with spores that allow it to travel all over, and if that gets washed into the ground and it finds dead roots, it'll feed on them. That's what a mold is. If you have a fruit and you damage it and bruise it, and then it starts, and you don't let it out to dry in the sun, and it stays moist and dark, a fungus will grow to help break it down and recycle it. In the human body, when a fungus works, it usually causes secretions out the skin that cause hardness and drying on the skin and severe itching. Like crotch itch, athlete's foot, yeast infections in women. It's very irritating. It's itching because it dries out the skin, the cells, when those fluids touch it.
So Louis Pasteur was on the wrong track.
Louis Pasteur, and he even said on his deathbed, my work is all in vain. It's not the bacteria, it's the environment, the toxic environment that's the problem.
It dries it out, so it's trying to do what? Detoxify it?
Well, it's a result of, you've got antibiotics, which are molds, especially penicillin. And when the molds that it gives you, the body reacts. It doesn't really resolve any kind of condition in the body. It poisons the body so badly. Those molds are not natural in the body because they grow them on grains, breads especially, cooked breads, processed. Then they sterilize those molds and then inject it into you. Highly reactive poison. So of course the body's going to stop doing whatever it's doing, whether you have arthritis or have a cardiac problem, no matter what it is, a tooth infection. If you get the penicillin injection, that mold in your body's going to stop using all of its time and nutrients on detoxing anything else in your body, and it's going to focus on getting rid of or neutralizing, storing that and isolating that compound that's been injected into your system. And that's how antibiotics work. It's like a child. You can say, sweetheart, if you do this and this and this, I'll give you this. And that's the way you encourage the child to think. But if you go up and slap the child and say, do that, that's what a penicillin is. It doesn't correct the mind. It doesn't correct the thinking. In fact, it alters the thinking into a bad place, where the child goes toward violence to resolve issues.
So should you ever have antibiotics?
I don't think so.
Wow.
Ever. You can do your own. Just take lime juice.
Lime juice.
Yeah. Or you could eat some mold, some live mold, and just a little bit of it.
You like cheese mold or what?
Cheese mold is a big one, yeah.
But that's good. I'd throw that out.
Well, I don't suggest that people eat too much of it. But if you want to stop an infection or something that's detoxifying too heavily, you could eat some cheese and it'll stop it. You may stink a little bit more, but it will stop it, Did that answer your question enough, Michael?
Yeah.
Okay. Barbara, do you have a question?
I just wanted to confirm with you. I know at one stage you did promote having that fine German silk cleaning your teeth now and again, and I do that, and I do this to my clients, but you haven't mentioned of late whether that you're against that or not now.
You mean using the clay as a...
The fine clay.
No, it helps polish your teeth.
Yeah.
So you use the clay with, some coconut cream or some other fat. It will polish the teeth. Definitely. It acts like a jeweler's rouge.
And then
The Terramin clay, yes.
The silk one
Yeah.
is finer. It doesn't. You think that would be the one for you, or you don't mind?
Doesn't matter. But the silk one, of course, was a better polisher. The silk is for the face.
Yes.
Terramin silk
Oh, I
is
didn't
for
know.
face
For the
masks.
face mask.
Yeah. It's finer, so that even is better for teeth, for polishing.
And then, rolling the clay up, it really does seem to work.
It definitely does.
Is it swatted? You roll it?
Yes, you make it
Make
into
it dough out
a
of it.
malleable. You don't have to use a fine one. You use any clay, any of the clay.
In fact, I'll use it to force an abscess.
Yes, raw.
Yeah, because it'll draw it out.
Very quickly.
I'll stuff the clay up in there.
And just recently with the clay, I have had a lot of, which Aajonus saw that I'd had a lot of X-rays, and I was lying in the sun earlier this summer, and these lumps some more lumps came up on my back, very itchy, just like the, not the squamous, what's the other one? Not the squamous cancer,
The
basal
squamous.
cell?
The basil.
Basil still. And I could just feel it, left it. So then I thought, I'll do the clay. So I got a piece of cotton, real, washed cotton, and put 1/4 of an inch of mixed clay, thick but not too sloppy, just thick. And scraped it up, put it all over the cotton, and put it over my back that night at 7 o'clock at night, and took it off, left it on over 12 hours, about 18 hours actually, in the end. And I wrapped it round and then put another cloth round. It stayed wet in camp all night. And it had totally gone. They were just not there for that long. Totally gone. So I believe that the sun brings out radiation
Oh, it does.
and cancers to the surface, and then you can draw them out with that clay. It seems so good.
Yep. Well, whenever the sun's radiation gets into the skin, it transforms the oils into vitamin D and other compound nutrients that are associated with vitamin D. Vitamin D is a great cleanser. It's also a bone builder, a tissue builder. So the sun can be used in a lot of ways. That's why I suggest, I see me soaking it up here right now, as much as I can. I work so much indoors now, I don't get as much sun as I'd like to. But I try to get about 10 to 20 minutes a day.
Good. Thank you. That's good.
Good.
So, it really does work.
Yes, it does. Sun is a very important nutrient.
So this remedy that Barbara talked about, is that in your book or anything?
Yeah, it tells how to clean the teeth. It's
No,
in,
the clay on the back.
Clay on the
oh,
back.
clay on the back.
Or anywhere.
Well, I tell people how to use different poultices, so clay's one of them. And you have to keep it moist.
You've got to be moist.
Yeah, you got to keep it moist. Once
So-
it dries out, then your skin will pull the oils out of your skin.
So when we detox with hives and stuff, would that
Yes,
be a good idea?
Hives, well, what I found with hives, it depends on what's causing the hives. If you have, let's say, radioactive iodine leaving through the skin, you don't want to use clay.
How am I going to know that? The Geiger counter?
Well, what you do is you test you test your hive, the first hive that comes out. You put whey on one and clay on the other side of it, and you see which one works. And that's the one you'll see. That's the one you use, the one that's working.
Because I get confused when you have all this body stuff come out. You've recommended coconut cream to put on it. You've recommended butter and honey. And you're right. I never know which one to go.
That's right. You have to do tests. I do tests on it. Now I can tell when one comes out of me. I know what to use right away because I've seen it. I've looked at it. I've analyzed it. But to tell you how to use that, measure it, not even with a picture could I do that.
Well, this last go around, I ended up. You're right. That's what I ended up doing because one didn't work, and I tried the other one.
That's what you have to do. Yep.
That's what you have to do.
Yep. So you find out which one works.
I'm a good scientist.
Good. Like that.
Thank you for telling me. I didn't know
Primal
that.
cream to it?
Pardon?
Primal cream, right?
Primal diatation. Primal. primal facial body care cream. Yeah, that's good. But he's talking about for rashes and hives. Yeah. And it depends on which discharge.
You know, this area here, fungus came out and was all white, and then hives broke out, and they started losing out. And it's like I had to keep switching it for the different things in the same area. But you're right, this is where they IV'd me with all those antibiotics in the hospital. So maybe that made sense that they came out on that one side and not the other side.
It was funny. These two right here, you see how bad they are? And I got stuck right here. They popped right out here. Why they didn't come out here and here, I don't know. Why it came out here. It traveled over to here instead, coming directly out where they put the needles. And it took they started about 3 weeks after the surgery. And they're still going.
Well, that's the other question. How long will they go?
Well, it was an IV. They put glucose in there, and, they have their other ingredients. And I'm sure they did some bad stuff to me while I was unconscious. We know what they do. Oh, this paranoid guy, we'll get him while he's asleep. Yeah, sure. Do you have a question? Uh-huh. Good. Yeah, that's good. Well, let your doctor have the heart attack. You won't. He will. You have to understand, people have high blood pressure and irregular heartbeat when they have congested arteries. They're supposed to have high blood pressure to help expand those vessels and veins. Because if they're congested, they're getting smaller and smaller. You need high blood pressure to stretch them, keep them open. If you don't have high blood pressure, you're likely to have a heart attack or an aneurysm. And that's what they want. They make a lot of money every time you go through a stroke and have a heart attack because you get hospitalized. How much does it cost a hospitalization a day? It cost me $6,000 for 2.5 hours. The operating room. And it costs about $3,000 to $6,000 a day for a hospital room. Plus, if you go into surgery, if you use a hospital room, the operating room, they make fortunes, and that's what it's all about. The pharmaceutical industry makes money out of you. They don't care what really happens to you. Cholesterol should be very high, especially on this diet, because half the cholesterol that shows up in your blood is going to be waste cholesterol that you're getting rid of. So it should be almost double what it was before. So if I keep around 400, I'm happy. No, I maintain it. Even up till 3 years ago when I had the whole bunch of cardiologists did a whole work down on me at Washington Medical School in St. Louis. The only factor that was really out of whack for them was my cholesterol level and my urine acidity. My urine acidity was 5.5. Very high. They think it should be much lower. It should be higher in alkaline. And the cholesterol level was sky high. And they didn't think that was possible. I said, okay, I've been eating all this fat, this high egg diet, this fat diet, this meat diet. All the time, that's what you've been saying is causing this congestive arteries and heart attacks, congestive hearts. I don't have any, do I? And I've been eating this way since 1976. So is there really a problem with it? No. And they had to admit it, because after they put me through all the tests, they took me up and they said, would you do some more tests? And I said, sure, depending on, as long as I don't get any x-rays or medication. And they said no, because I did take the glucose for the glucose tolerance test. And they found that I was a juvenile diabetic, and they said I would always have to take insulin. On the last phase of the test, my blood sugar went down to 54. They say that 104, 110 is about the lowest it will ever go. My pancreas is so healthy getting rid of that toxic sugar, it went down to 54 in their glucose tolerance. They couldn't believe I had the healthiest pancreas that they'd ever seen. They didn't even see that kind of healthy pancreas in a child. So they took me up to the gym. So they put all these, electrodes all over me, and I was pumping all this weight, and I don't exercise. This is my exercise on my computer. I literally don't do anything. And I've got all this muscle. So they put me on the leg press. So I did 280 before I started straining. And then they said, okay, that's enough. And I said, wait a minute, I'm just starting to strain. So we're causing a heart attack here. So I got 280. And then I went to the bench press, and I did 190 before I started straining. And then they put me on the treadmill. So I ran 5 miles. And my heart, after each exercise, within 3 minutes, my heart was perfectly normal. They couldn't believe it. They said, we have people that work out here 3 and 4 days a week that can't do what you do. So the proof is in the pudding, And you have to understand that I had congestive problems when I was 15 years old, and other problems. I was having heart attacks. I had 300 heart attacks by the time I was 22 years old. 50 of them put me unconscious.
About the age that you were talking about, what's the normal age for time?
They think 6.
Right, but what about on the diet?
It should be about between 5'5" and 5'7".
I was curious about that.
What should be?
pH in the urine.
And the saliva, maybe 6.
That'll vary depending upon what you're eating.
What you eat.
What you're eating.
What about like when you wake up?
I was a heavy smoker. 8 months ago, I started detoxing my smoke for the first time. All these years, I haven't smoked since I was 24. And it's the hardest thing for me to give up. I love smoking. I would smoke today if it were healthy. I loved it. But I'm finally coughing the way I was when I was a smoker, so I started rejecting all this. And some of my mucus comes out gray and dark brown. And look it up under a microscope, electronic microscope, and you can see they're tars. They've been sitting in my tissues all these years. Like I said, it takes 40 years to clean the body out completely if you're perfect on the diet.
So high glucose not helpful either?
No, because again, it's just you're going to get rid of a lot of stored toxic sugars. Columbia University said that the human body stores 70 to 90% of all of the advanced glycation end products that are formed in the body, stores them for a lifetime. When you go on this diet, your body starts throwing them off. So you're going to have a lot of old toxic glucose that has nothing to do with what you're eating now. Same with the cholesterol. You've got old toxic cholesterol that's been stored in your body. So your cholesterol should double.
But what if you were a vegetarian for so many years?
You've got even worse. You've got even worse problems. You've got vegetable oils which harden and crystallize.
It's only if I use oil.
If you used oils, yeah. You didn't need any peanut butter. You didn't need any of that oil, any nut butters, anything like that. Okay.
Vegetables too.
Yeah, of course. Cook the vegetables. You got to cook oil in your vegetables.
I never ate any of the cooked vegetables.
Oh, you didn't? You ate raw vegetables?
I was skinny out of grocery store.
But you weren't healthy.
Skinny. Not healthy.
Yes. I prefer fat and healthy.
I know.
Fat and happy. Joseph, do you have a question? Egg white. Yeah. Yep. Also, I have one fellow who has a constant conjunctivitis. His brain just keeps dumping out his eyes, his tear ducts instead of his mouth. Because he has such bad mouth, his body decided to start dumping it all out of his eyes now. So I have him mix a little bit of lime juice with an egg white. And he puts that in his eyes several times a day. And that keeps the bacteria levels down and the irritation on the eyes down. And it cools his eyes. But it's just a touch of the lime juice with the egg white. But egg white cools. Egg white alone cools the cornea. Well, what I do is I'll just take, an egg, and I dip my little finger in it and get a bead of the egg white on there, and then I'll hold the eyelid down, the lower one, and I'll look way up, and I rub it along the bottom of the eye, and then I'll roll the eye like this, and I'll lift the upper one, roll it like this, so I get the egg white all over. And this cool and calmness and soothing just goes all over the eye within seconds. It's so wonderful.
Does that improve vision?
Yeah, it does. Yeah, the people who've had very bad vision, if they do that 2-3 times a day, usually within a year their prescription is reduced by 20%.
What about those little things you get inside the flare of your eye?
It can, but usually that takes a bacteria to break that down, or fungus. Yeah, it's the scarring of the tissue. The body has thrown something out through the cornea and has caused a scarring and blister there. And that scar tissue is hard to remove. Well, it does if you put enough of the egg white in. You have to put more than I just suggested in there. And what it'll do is the body will eat the protein in the egg white and go in and help strengthen the maculars so that they don't disconnect as easily and they can regenerate. But I found that red meat, against all theories, the eye is more, less muscle and more nerves, and it should be white meat related, but only red meat will alter, ill focus, blurry vision, tired eyes instantly, within an hour and a half of eating the red meat.
What about sitting at a computer a long time and your eyes get blurry? Is that just from...
Well, if you're using a radiation screen, that's not good. If you have a monitor that's thick, you've got 3 laser guns in there. They shoot up to 27 feet, so you're just burning your eyes. You get a flat screen where there's no radiation in it, or the radiation follow-up's this far, not 27 feet.
What about a laptop?
Laptop is just a flat screen. Just use a separate keyboard. Because the EMF field coming off of that computer chip is about usually anywhere from 75 to 100 gals. Joint pain, causes carpal tunnel syndrome. Just remember, when back in the days when I was learning to type, there was no electric typewriter, and secretaries use those all the time. My wife was a secretary, pounding on those old typewriters. Never got carpal tunnel till electrical came into being, and then carpal tunnel. And they deny it every day. They deny that it's electrical, and it definitely is. The way I realized that the worst was when I got my first laptop. After a week, I had tremendous pain. I thought, oh, I'm getting bone cancer again. This was, 1997, I think it was, 1998. And I was having a lot of difficulty. And I had just moved, it was 1996. And I just moved into a new house. And I didn't know if it was the house or what it was. So I had an environmental expert come into the house. And he brought out all of his meters and gauges and went all over the house. Only found one plug in the bedroom that wasn't properly, grounded. So I ground that one. And he said, I don't find anything here that would cause that, no high radon or anything in your house. And he said, turn on your computer. So I put on my laptop, put the gauge down there, and the thing was just off the meter. He said, there's your problem. Get a separate keyboard, plug it in, and then keep the distance away. He said 6 inches because he took the meter. See how far away from the base of the keyboard from the laptop, at the bottom of the laptop, how far the keyboard had to be away. And the top of the keyboard had to be 6 inches away from the bottom of the laptop. And then 2 days later, no carpal tunnel. Just went away like that. So, the industry and government is lying again to protect the industry.
How can you tell if you've got an ordinary computer screen? How can you tell if it's a good one or not?
A flat screen has no guns in it. No radiation guns. No. I'm talking about you've got a thin screen.
One's a big box.
One's a box, a monitor, box. A flat screen means you just got a panel, a flat panel. Okay, that's fine.
So I have got a flat panel. Otherwise it's like a TV, it comes up.
Yes, that's 3 radiation guns in those. Flat screen's fine. Yeah. It burns and stings a lot, and it gets sticky, so it's not good in the long run. And if you want to put honey in your eye, put it on your eyelid, and it will go through and get into your eye.
What does that do?
Well, it can help break down things like, scar tissue. Also help get rid of wrinkles and lines at the same time. Do you have a question?
Yeah. Wash my hair, I'm using eggs. I want to get away from
I use soured coconut cream. You get the alcohol in it, it's one of the best soaps you can use. Sometimes it gets the skin too dry, so, you might, want to not leave it on too long. That is a natural soap. 50 years ago, all body soaps were 90% coconut. That's what they used. Coconut cream, dried coconut cream. They just mixed it with lye and fat. What? Well, that's not, the best is use the coconut cream that's soured that you're not going to eat.
There's no way you can buy that.
Pardon? I keep it in the fridge. Yeah.
And you just take like a tablespoon of it in your hair out each time you want to shower your hair.
Well, if you use it for your hair, it's going to make your hair thicker.
Really?
Yeah.
I mean, for shampoo.
If you use coconut cream on your hair, it's going to be thicker and oilier. It doesn't on the skin. It takes the oil off. In the hair absorbs the oils in the coconut cream.
So how do you want to do it? You want to wet your hair first?
No, you wet your hair and put egg on it. And if that makes it too dry, then you put a little bit of, maybe a spot of oil or just a couple drops of milk in with your egg, and that'll be a conditioner. But what I used to do is when my hair was long, remember how long it used to be? I would wet my hair and whip an egg and put it on. And that's all I did. Whole egg. Whole egg, you put it on. And that would clean my hair. That's all I used. Yeah.
Yeah, you just wash it out.
Yeah, just rinse it out.
What do you do with the coconut?
If it's dry.
No, we're talking about for the body. Yeah.
Okay.
But you asked about using it on your hair, and I said, coconut, if you got short hair like this, you can get away with using it. And I did. I used coconut cream last night for my hair, and it looks pretty good, though. But you have to take a towel and scrub the oil out of it. Because when it first happens, my hair will look dark, very dark, because there's lots of oils. But it's a water-soluble oil, so it comes out in the towel pretty easily. But still, I don't have a long hair to deal with it anymore.
So if you don't have sour coconut cream, you don't recommend using any other commercial soap?
I just say get in the bathtub and let the water, just work away and rub it off with a, washcloth.
Run out of sour coconut cream.
You can use fresh coconut cream. Oh, you're out. You mean dry coconut flakes? Yeah, that's dry. Yeah, won't work. It'll turn very sticky and it'll play cake in your hair. It's a mess. I've tried it. I've tried everything.
Health food stores, I know James has that, but it's so far to go. Do health food stores have that?
Coconut cream? No.
He's the only one that sells it.
Like I said, before we had these machines, I put up a 3x5 card at a high school gymnasium, and I said, need somebody who likes to break things, $8 an hour. And I got 50 calls. And I chose a African-American skinny end on the football team with a lot of energy and hyperactive. And I had him come and break the coconuts, drain the water out of them, pry them loose, cut them up, put them through the juicer, juice about 10 coconuts at a time, and he would put it in the small jars, blend it with the lime juice, did the whole process for me. So it took him 6 to 7 hours to do it, only cost me $60. And that lasted me for 5 to 6 weeks.
10 coconuts.
Pardon?
10 coconuts.
10 coconuts.
The cheaper the James.
Oh, yes. Oh, yes.
And what if you just eat it and use it as soap?
Yeah, well, not a lot cheaper, but it's cheaper. He charges $11.50 or $11.95 for a pint, so...
How many coconuts is that?
Yeah.
It's about 2 coconuts.
Yeah. 2 coconuts, yeah.
You make some coconut cream and broke the shell on it. All you do is spray it
You can cut that off. If it went deep into the meat, it's going to be in your juice. Usually cut it off. But if you see the pearl, the brown stuff, like on a almond, they've got that skin on it. If that is completely worked away, and you've got mold under there, yellow and blue, and it's deep. It's deep into it.
But they'll take it back. You get the money back.
Yeah. But I'm talking about don't throw it away. Take it back, but don't juice it either. But if it's just lightly, let's say you've got the browns on there and you see all these little gray spots all over, you can just peel that off. It's still juice. But yes, it's easier. Definitely easier. Do you have a question, Mike?
Just kind of wondering what to expect as far as normal detox. I'm getting some headaches. How to deal with that? Like that. Or feel like you're detoxing.
Well, your body will decide that, and you have to decide whether you take it or not. It's just a matter of handling it. But if you've got symptoms, like headaches, you look in the headache formulas. When you do the headache formulas, get rid of the headache.
I tried one, it didn't go away.
Then you had a migraine?
I don't know if I know what a migraine is.
Yeah. Because they don't work for a migraine. You have to take the pain formula for a migraine. Did you try the pain formula? Okay. In the rest of your book, try the pain formula where you're eating the cheese and the bee pollen. It's like taking the lubrication formula, add bee pollen to it, and eat it with cheese.
I'm glad you brought that up. I've had bee pollen for years and years. I've got more allergic.
Well, you haven't had any fat in your body. So, you just have to get fat. Get fat and you have less symptoms. Yeah. I had a hell of a time getting fat this last year, and finally, after I got rid of that, that stone, I was able to start gaining weight. I think what happened was my body was using that location to dump heavy metals, and then it stopped. And that's why I started having the problems that was coming out my skin, because I had all kinds of skin cancer for about 6 months. I mean, skin cancer, I still have one here, back here, but I had them all over my legs and everywhere. And it was not the squamous, it was the basal cell cancer. And, everybody goes in and out of cancer. You just don't panic. And as soon as that stone was gone, it was all but this one. They all just disappeared within 2 weeks. So my body was throwing the heavy metals out my skin. So just have to find whatever remedy works for whatever you're going through. And for your headache, probably the pain formula will work. And, also putting a hot water bottle on both sides of your head. Because when you get a headache, the brain swells and the skull doesn't expand. So then you got this pressure on the brain. And it's not the neurons. It's the meningi. It's the 11 layers of skin around the brain. Because, you can do open brain surgery while you're completely awake and there's no pain. But the nerves surrounding in the meningi is which is put the pressure against the skull and the rest of the brain. And that causes the headache. So if you take hot water bottles and you lie back on a bed and put them not pressed against, but lightly against, and put a towel over your head and even over your eyes, and the hot water bottles will concentrate the heat into the skull so that all of the tendons that hold the brain together, the fissures together, will relax and expand. Then your skull expands and usually 85 to 90% of the headache goes away. And then you have the pain formula before you do that. And usually you say, wow, I know I've got a headache, but it doesn't hurt. Because you still feel the pressure, but there's not that pain anymore. Okay? Do you have a question? Okay, do you have a question?
I had an accident at work. I was, a large walnut fell on my right shoulder. Actually, my right shoulder is lower than my left. And I've already got a herniated disc on my neck. I was going to get an MRI because I couldn't look at it. But anyway, what happens to me is that I get, not all the time, like right now I don't have it, I get extreme labor-like pains on the lower part of my back. And I also get it on the front. It's like I'm either going to be on my period or going to have a baby. It's horrific. And then I also get numbness and on my legs and my arms. And then there's times where I just feel weak and just want to lay down and just stay real still. I've done the milk and the eggs, and it's hard for me to do all of it like that with the banana in it. And it seems to relieve it for a little bit, but it doesn't. I'm wondering if I'm going to get well from this, will I heal? Another friend has said to do the glyconutrients, and I just don't want to do stuff that I'm not supposed to do, but I want to get well.
Well, to concentrate the minerals for an area like that, you need to eat cheese with honey. They need to be put in the mouth together at the same time. So if you ate twice a day, 1.5 to 2 tablespoons of cheese with 1 to 1.5 teaspoons of honey twice a day. When you eat cheese by itself, cheese acts like a magnet and a sponge. It's not digested. It's a dried food. Any dried food does not have bioactive enzymes and does not digest unless your pancreas makes the hormones to go out and leach from the body. But when the body's on a diet like this one, it will reserve the cheese and not digest it. It'll be used to attract by the mineral content, all the calcium and all the other minerals, as the neurological system and blood and lymphatic system pass through the intestinal tract. The cheese will draw the poisons out into the stomach and intestines, lock onto them, hold onto them like a sponge, and then travel throughout the feces. If you eat honey in other foods, the honey's already connected with other food and won't be used for the cheese. If you want to get a high concentration of minerals from the cheese, you eat it with honey. You eat them in the mouth together. The honey goes right into the cheese. Then the body, the liver will identify the honey relating to the cheese. Because the pancreas, not the liver, the pancreas takes the enzymes from the food, realigns them for us, sends them back to the digestive tract. That's a pretty easy job as long as we're not cooking our food and eating lots of toxic sugars. So the pancreas will take those sugars or the enzymes from the honey and reconvert them back into to utilize the minerals and the other nutrients in the cheese.
So when I get a problem, I'm not utilizing my...
You're not utilizing enough.
And what about the glyconutrients? She says it's like a brand new science that came out. No?
It's not a brand new science. It's come and gone. They were doing that in the 60s. And then they found there were all kinds of side effects. So then it went undercover. Now they brought it out again because everybody's forgotten.
I didn't even know.
Yeah.
What's a glyconutrient?
Well, they take a sugar byproduct, which is a finished sugar that's supposed to have been already digested in the body, and then they utilize it for fuel and energy and as an antibiotic. They're using it as, like they do everything, as a cure-all until they find out that people get so toxic with it, it causes the opposite reaction, and then it goes away. Like MSM is dying out because people are getting very sick from it. You know? So MSM is sulfur-based drug. You know, what it is basically sulfur, mined sulfur. Any mined substances in that concentration is going to create a severe imbalance. And look at the nature of sulfur; it dries things out terribly.
How long am I supposed to have to choose the honey? Only when I'm in pain and when once it goes away?
I would say every day, the rest of your life. You got that kind of problem.
With the raw butter,
Well, what?
the butter, with the raw butter, with the cheese and the honey.
Won't be utilized for minerals.
How about the
It'll
raw
be
milk?
utilized for fat, fuel. It'll do a lot of different things.
How about
But
the
it won't concentrate the minerals.
Let's wait for us to eat cheese then.
Yeah, depends upon what your problem is.
I don't have a problem.
And if you weave in and out of problems, then you use, you
Well, you
use
don't have a problem.
change over.
How do you eat it? You don't have a problem.
Whatever way you like. There are always problems. You've got toxins in your body. Eat the cheese to draw the poisons out. If you find you've got a mineral imbalance, if you're having pain, you've got a mineral imbalance.
Can you add it with different food?
Yeah. Eat it with any food, yeah. But if you eat it with, if you eat it with anything other than honey, it's not going to digest. It's going to act like the magnet in the sponge. Always. Yeah, that's fine. Absolutely. Got tons of poisons leaving the body all the time.
Especially when
Inhaling them and everything.
When you're nauseous, you eat more cheese.
Absolutely. Yep.
Put cheese in the meat with the honey.
Uh-huh.
Is that going to work that way, or is it just meat? Change it up?
Got to have the honey with the cheese. Only it won't work otherwise. You can experiment and see. I've done it plenty of times.
You're right.
Sometimes I eat a lot of cheese. Sometimes I'll go to the bathroom and I feel like running around.
Yeah, that's right. Pulls the poisons out, yep.
Just like running around.
Yep.
I can still drink milk and have my milkshake in the morning.
Yep. Because you're going to use, you need the calcium from the milk for your normal everyday things. That cheese is isolated.
So if I take the cheese, do I wait after I drink a milkshake, do I wait like an hour or take it?
About an hour. Do you have a question?
Yes.
What about taxes?
Nope. Nope. With the cheese and the honey, where does the minerals come from? I've never heard of minerals being in milk and
Cheese.
Yeah. Where does it come from?
In milk. Milk
Well,
is concentrated in minerals,
Yeah,
especially in calcium.
I heard of calcium, but
So it's when you dry it, it concentrates the minerals in there. But you can't release them without the enzymes. And that's why if you mix the honey with the cheese, it releases those minerals.
how many minerals are there in milk?
There are almost every kind of mineral there is.
So
I mean,
about
there's
70 some?
I think there are about 83 to 86, depending upon what the cow's eating. There are 103 elements, 106, 103 elements, and there are about 86 in cows. And, even a trace amount of strychnine can be found, but it's good in trace amounts because the body can use it as a anti-insect or insect repellent. The body can make that into that with some fats. And that's a natural insect repellent that animals make with strychnine. And we would, if we were healthier, we'd probably be producing it too. But yeah, all those minerals in milk are dried into that cheese and concentrated. And when you mix the honey with it, remember when honey, the bees collect the nectar. And when they swallow it, they pre-digest it. They form an insulin-like substance which transforms the carbohydrates, 90% of the carbohydrates in honey, into enzymes for digesting proteins and fats. So when you eat the honey with the cheese, you're giving the enzymes to the body to make sure that you break down that cheese to be able to digest it and utilize the substances in it. And it's got concentrated fats, concentrated proteins, and concentrated minerals. And they're in a form which can be cellularly absorbed. That way they can rebuild teeth, they can rebuild nerves, bones, everything.
Well, I thought the cells were depleted, so where do the cows get the minerals? They don't get it in the food.
Yeah, they do.
Well, I thought all that is...
It's all theoretical bullshit. You take a look at milk and you break it down, you look at cheese under a microscope, and you'll see a concentration of minerals all over the place. Yeah, they wouldn't grow. And those animals are very rarely sick. Unless somebody's, in a neighbor has, dumped some chemicals and gotten over to the cows and they'll get sick. Or they've been given dewormers or vaccines and they'll get sick. Then they demineralize because the body uses the minerals to bind with those toxins. Just like plaque. Your tongue, when it's full of that plaque, that white stuff, it's heavy calcium surrounded by all these chemicals and poisons coming from the brain. When I looked at it under an electronic microscope, there was mercury, there was aluminum, there was all of these compounds that come from nerve tissue surrounded by all of this fresh calcium and potassium and phosphorus from milk. He's saying that so people will send him money. He makes $3 million a year. He's the biggest racket jerk I've ever known. They don't know him. He owes me fortunes. I helped him get started. He owes many of my clients, including Martin Sheen, hundreds of thousands of dollars. And he's making these millions, bragging about it, and he won't pay us. He won't pay us. Plus, he's no longer organic. He's no longer organic. He does not feed them organic feed. He feeds them processed garbage, and he leaves the label organic pastures because that's the name. He doesn't claim anymore on the bottles that it's organic. He's a real shyster. He's a crook, as far as I'm concerned. Pardon?
Is there another raw milk up there?
Claravale. No.
So you
do the best you can. We lived in Claravale for 3 years until Organic Pastures made his. But I would eat Organic Pastures if I had nothing else. I ate Claravale, but I would eat Organic Pastures over Claravale. Because Organic Pastures, at least there's grazed on fresh grass. Claravale doesn't get any fresh anything. Yeah.
Where do you get your milk?
We ship it all the way from Pennsylvania. Amish farmer. We have a truck that comes every week.
So you don't fly it? Why won't you
Trucks.
fly it?
Very expensive.
We can outside it.
Pardon?
We can outside it
Yeah.
from Thanksgiving.
That's fine.
You get it the next day.
Pardon?
You get it the next
Yeah.
day.
Well, ours comes the same day.
Same thing.
Yeah.
By truck.
Yeah. Pennsylvania, it's got a truck that drives straight through, makes it in 24 hours. Refrigerated truck.
What do you ask for?
Pardon?
What sort of cartage do you ask for? I mean, shipping.
Oh, no, it's a private shipper.
Oh.
He does it just for us. He's got an empty trailer from Pennsylvania to here.
All right.
So we got him to do it for James got him to do it for a very inexpensive.
We can't get it done easy.
No.
So how do you want to do it?
You have to go up and get it.
Where do you
I
get
know.
it? Where do you get it?
What do you mean, where do I get it?
Oh, I'd have to go to Malibu. Well, I live in Malibu.
No, you have to go to Venice.
Oh, I'm close.
Yeah. 665 Rose Avenue.
I thought Cynthia was getting it here. Wasn't
What's
Cynthia?
bus?
No. No, there's plenty.
You get all of yours.
I've got them on the product list. There's lots of names.
Can Amos supply that much milk?
Oh, yeah. Yeah. Plus he has other farmers that give it to him if he doesn't have enough.
He's on it.
Yeah. Yeah, he's on
They
it.
sell that milk to local dairies. There.
Not anymore. It all comes to all of my patients. All of us. Yep. We're just growing all the time, so they keep expanding. We took on 2 new Amish farmers just in the last 2 months. Plus, in Chicago, there are so many people on this diet. That whole area, they've got 3 in Indiana, the whole area there. They've got 4 dairy herds supplying all those people. That's why the FDA and the state of Michigan came in, were screwing around with us last week, the week before. Well, we're getting buffalo, and we lost our New Zealand supplier. So we do get meat from Amos, but he only slaughters every couple of weeks. So when he slaughters, we get whatever he's slaughtering.
Is that permanent?
I don't know. It looks like we're not going to get it anymore.
They told me that we had to do like I mentioned that Sharon.
We'll see. Do you have a question?
That the poisons are inside the pulp of whatever it is you're juicing, so that it doesn't come out in the juice and stays and your juice is not contaminated with whatever you're using in produce. Is that true?
That is mostly true.
Oh, yeah.
Mostly true. Yeah, what she asked was, someone's told her that when you have an inorganic food, if you're juicing like a vegetable, that the toxins are built into the pulp and therefore it doesn't get into the juice. That's about 90% true.
I just bought a new Green Star Tempo juicer, and they're saying that it's claiming that that's what it does.
Well, 90% of the time that's true. But some of it's ruptured, and some of it does get into the juice, but not a lot. I like the Kimpo was when I got it, I sent it right back because it was too small. It takes too long to juice for me. I don't have that kind of patience. So I went back to my Green Star Gold, they call it now, the bigger one. Because it takes a long time to juice in that little juicer.
Well, I know, and that's the one I was going to buy, and I was talking to people. I bought mine through Costco juicers in Carlsbad, and he was telling me that this new chemo one, just the benefits of the juice count so much better, even though you have to still cut stuff out.
Yeah, it doesn't make not that much difference. Yeah. very time consuming. I was so disappointed.
That's right. It takes a long time to
You have to give it back.
I just sent it back and get the other one.
If you've already used it, you can't put it back.
Oh, bullshit.
No, you send it back in 30 days.
Yeah.
Yep.
And it cleans pretty well.
That's the one I said. I was going to give it the gold. The honor of the green.
Tell them it takes too long to juice with that thing. You want the green Star Gold.
So what one do you got? The Kempo. It's the newest one out.
It's the newest. It's got a tighter gear. It's a thousandth of an inch tighter. So you get just a little bit more juice out of it. And your pulp will come out drier. I just put my pulp through twice or 3 times rather than giving a Kempo. And that does the same.
So it's got a bigger shoot then?
Yeah, it's got a much bigger shoot. And the juicing screen is this big compared to this big. Big difference.
It's time for me.
Very time consuming. That's true if you don't bottle it like I suggest in the books.
Right. Okay. So the honey in the juice
Helps
really
preserve it.
for
Yep.
72
No, 3 days.
3 days.
I've even had it last up to 4 days in the winter, where it's not warm.
And it has all that vitamin content.
Yep, you can taste it, it's fine. All of a sudden on the 4th day you feel it going flat, starting to ferment. But then it's a good detoxifier. What time is it?
4:30.
Okay, that's it. We did it.
On the, it still has the mineral content even if it goes sour.
Oh, yes, it definitely does.
So you can have it for 7 days.
Yeah.
If you juice too much.
Yeah, but it's mainly for detoxification for the 4th, 5th, and 6th, 7th days.
But you're still getting the minerals after the...
It's just that
Yeah, but the minerals won't be utilized to strengthen your body. They'll be utilized to detoxify.
So when it gets sour,
It's entirely
throw
different.
it out. When it gets sour, is that what you're saying?
Well, it gets sour, you could use it for detoxification, but I don't expect it to help you digest anything.
So
Yeah. It's better to make it for 3 or 4 days max.
pain in the ass.
That's only an hour.
No, it takes us 2 hours. It's just in the kitchen looking like
What juicer do you have?
Same one.
Same one? Maybe I should have a class here one next time for Christmas to show you how to do it faster.
Oh, really?
To juice faster, yeah.
I see what
Yeah, that's right. It takes me an hour.
For a gallon of juice, it
Yeah.
takes me an hour.
I swear, it takes an hour. She likes to prep everything up pretty
Oh.
nice.
Cleaning up
I just don't. And she's like, this is a mess because yeah.
So the carpal tunnel stuff is just a lie, right?
No, carpal tunnels, yes, but it's from the electromagnetic
So
field.
if you play the piano and you get carpal tunnel, do you just do from just overuse injuries? Can you do better than
That's from just a lot of toxicity in your joints, probably in your bone marrow, leaving your joints. That's not carpal tunnel. That's arthritis and rheumatism.
Oh, okay. The second. Oh, my little one. Okay.
250. Yeah.
If I call you in the morning between now and then, would you have time to look at my file and see? I'd like to know what the prognosis. I never did ask you what the prognosis is.
With your eyes?
Yeah, I'm really concerned about this. It's not getting. Everything's not getting better. It's still not.
Yeah.
Still definitely not getting better.
You're still getting headaches?
I'm really concerned.
Because you're headaches or what else?
Well, because this is collapsing.
Oh, your skull.
Yeah.
Okay, well, give me a call between 7 and 9 a.m. Tuesday through, next week.
Okay.
Okay? Yeah, because I'll be back on Tuesday.
Oh, okay. Then you have a time before you to look at it.
Yeah, and I'll just, what you'll do is call me.
Yeah.
I'll pull up your file, and you tell me what you need to, I'll ask you for all of your symptoms. By the time I get it up on the screen, I'll be able to take a look and see what's happening.
Okay.
When did we do your eyes last?
February 1st.
quite a while ago. So we'll see if, because it could have changed. So.
Yeah. And listening to everybody's talk, I do have some
Dental issues?
and I'm wondering if that's the source of the infection.
Could be. See, like I said, when your body uses minerals like that, it takes them from the rest of the body to bind with poisons. And your body will actually, like a cancer patient, their bodies eat their own bones to get the minerals. They start getting severe osteoporosis.
That's what happens.
So I feed them tons of cheese and honey together, and they get osteoporosis.
So that's what's happening to my skull.
Cheese and honey.
Yeah, I do.
You've been doing that?
Oh, yeah.
Okay.
Yeah.
And you may have to do it 3 times a day instead of 2 times a day.
I might just have to eat it all the time, all during the day, every day.
That's what I did after my surgery. I wanted to make sure I wasn't going to be deficient in any minerals.
Right. Okay, good. Thanks.
Do I need to call it for the mail for Judge to go up and get it, or for the
Oh, you just go up there. That place sells everything on this diet. Cheeses, honey,
And that's in
meats,
Venice, right?
fish, everything.
It's somebody's house?
No, it's a corrugated fence. It looks like there's probably some mechanic garage behind there. And you go into that gate, and it says on there, Rawson Club.
Oh, okay.
Rawson Club. 665 Rose Avenue.
Or one car.
665 Rose Avenue.
I put 2 5 on it.
It's just a block and a half west of Lincoln.
Oh, okay.
Did you have a phone number memorized? And the name of the place is
Rawson. R-A-W-E-S-O-N. Rawson. It's not listed. It's open on Wednesdays from noon till 8 o'clock, and on Saturdays. Are you done talking? Yes.
Okay, great. And then on Saturday?
8 o'clock on Wednesdays.
And on Saturday?
Saturdays from 9 to 2. That's 9 in the morning to 2.
So people just leave it open till 2 o'clock in the morning?
Right.
I had a 50 here. There we go. Thank you. Thanks for coming again.
We have the meeting. I have the
Oh, Minnie, let's go inside where it's warmer. Thank you. Yes.
So Lane's at 5, just let us know.
Yeah, thanks, sweetie. I don't know. Can you come back in December? Or because we're going to have a potluck in Venice for Thanksgiving.
Is that day after Thanksgiving?
No, it's on the Sunday. We always do potlucks on Sunday, so it's the Sunday following Thanksgiving.
I saw that.
That's on the beach. Yeah. That'll be going out. I just think I said that one, didn't I?
Yeah, you just said it. I got the Thanksgiving.
You got the announcement for it. Yeah. Okay, kiddo. I'll see you again.
Oh, good.
I like your skin. It's getting healthier.